Hi everyone, my name is Dr. David Kulla here. We have a patient with hiatal hernia, acid reflux, GERD, Barrett's esophagus. And we talk about this, Barrett's esophagus being precancerous cells, and their only solution for you has been what over the years?
Taking a prescription like famotidine and what do you call the other one?
Omeprazole?
Omeprazole, yes.
Okay, yeah. You know, they have a couple of different types of medications, PPIs, they call them, omeprazole, fomeprazine.
Famotidine.
Yeah, I can't even pronounce half the names. But it's not a laughing matter. A lot of people are suffering with acid reflux and GERD and feel like there's no way out and the medication doesn't work. And in his case, it hasn't. But even worse, he now has Barrett's esophagus. And how long have you been taking the medication for?
At least more than a year.
More than a year?
Yeah.
Okay, and when did you find out you had Barrett's esophagus? Before you started the medication or?
Before.
Before?
Yes.
Okay, and before you started the medication, did you have acid reflux?
Oh, yes.
You did, and you just dealt with it?
Yes.
Okay. What did you do, take antacids? Or?
Antacid, yes.
So he took antacids for years, and finally that wasn't working anymore. And that led him to going to the doctor, finding out he had Barrett's esophagus. Yes, that acid can cause Barrett's esophagus, especially if it's chronic. So I have a solution. I developed something called a reflux shield. And you've used it. You used it this morning.
Yes.
How many times have you used it so far?
So far, we've done that here twice, right? I mean,
I've done it to you twice.
Me twice, and I did twice, and I feel relief. Yeah.
Okay, so he's now off the medication,
Yes.
right? For the first time in a year?
Yes.
Okay, and now, but we have the Barrett's esophagus to deal with, but he's off the medication. He's used the reflux shield twice. I've done the maneuver on him twice, and I may not do it today because he already did it this morning and he has the reflux shield, so he can do it on his own. And wouldn't you agree, using the reflux shield device, it's less abrasive than me with my finger?
Oh, yes, of course, definitely.
And you can control it, how deep you go. So again, the reflux shield is nice and easy to use. It's more user-friendly than my thumb. Trust me, my thumb is, I don't know, my fingerprint's rough, I guess, but it's, you know, I use the pad of my thumb and it's a bit abrasive, you know, and the more dry your skin is, the more abrasive it can be. The reflux shield is meant to be used without lotion to be smooth, but if you need a little bit of lotion or Vaseline, you can certainly use it, but just use a teeny bit because you don't want it to be slip and slide all over your stomach, right? So that's great to hear that you're doing well, okay? And if you guys have Barrett's esophagus or if you've been diagnosed with that, I suggest getting some aloe vera, getting some concentrated aloe vera and actually diluting it with a little bit of water and drinking 2 glasses of that a day, separated morning and evening to kind of heal the lining of your esophagus. And then, of course, correcting the hiatal hernia. And the only thing that does that, you know, pulling it down to fix the acid reflux is the reflux shield. The other option is medication, which, as you said, didn't work for you and doesn't work for a lot of people. And then there's surgery. Try the reflux shield before you get to surgery, okay? Hopefully we do a follow-up with him in a year and we have better news after your barium swallow and your endoscopy. And, we're going to track this Barrett's esophagus for you. Okay? All right.
Endoscopy probably 6 months to a year.
He told you to get one in 6 months to a year? Yeah, I would definitely agree with that. So if we can stop the acid, we can stop the progression of the Barrett's esophagus. That's the best we can do. And then from there, you know, the aloe vera juice and just healing the lining of that esophagus. Thanks for tuning in. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.